Let me share something that I've learned over the years working in healthcare as a nurse and now as a nurse practitioner. Healthcare is not as simple as people think it is. And I say that with over 25 years of experience, starting as a nurse and now practicing as a nurse practitioner in a very busy setting. What patients see on the outside and what actually happens behind the scenes are often two very different things. Hi there, I'm Kisha Pickford, a nurse practitioner with over 25 years of experience in healthcare. And on this channel, I share real talk about what it's like working in healthcare and the lessons I've learned along the way. I've been in healthcare since the early 90s. I started nursing school back in 1989, graduated in 1994, and I've seen a lot of changes over the years. And one thing that has remained consistent in healthcare is that it is complex. It's not just about knowledge. It's not just about caring. And it's definitely not just one single decision in a moment. It's about balancing multiple things at the same time every single day. And what I've learned is that providing care is not always as straightforward as people might think. As providers, we are constantly balancing patient needs, time constraints, system expectations, safety considerations, and clinical judgment, all at the same time. And sometimes that balance is not easy. It doesn't mean we don't care. It doesn't mean we're not trying to do what's best. It means we are working within a system that requires us to make decisions quickly while still trying to provide safe and effective care. In fast-paced environments, especially settings where there are a lot of patients and a lot of moving parts, there are pressures that people don't always see. There are expectations around time. There are expectations around flow. There are expectations around documentation and decision making. And while all of those things serve a purpose, they can also create challenges when you are trying to slow down and give every single patient the time you wish you had. And I'll be honest, that can be one of the hardest parts of this work because most of us went into healthcare to help people. We want to listen. We want to connect. We want to take our time and make sure everything is right. But the reality is sometimes we have to make decisions in moments, and that responsibility carries weight and it stays with you. So when you're in a healthcare setting and things feel rushed, or you feel like you didn't get all the attention you needed, I want you to understand something. It's not always about someone not caring. A lot of the times, it's about providers doing the best they can within the structure they're working in. And this is why communication matters so much. If you don't understand something, ask. If something doesn't feel right, speak up. If you need clarity, say that. Because good care is a partnership. And the more we understand each other, the better the outcome can be. And over the years, this is actually what has led me to become more interested in prevention and wellness and helping people before they even get to these high pressure situations. Because there's so much we can do outside of the system to support our health. So I just wanted to share that perspective today, not to criticize, not to complain, but to give you insight, because healthcare is complex and the people working in it are navigating a lot more than what you can see. And if you're in healthcare like me, you probably understand exactly what I'm saying. And if you're not, I hope this gives you a little more understanding the next time you or someone you love needs care. I don't know who this is for or who will see this today or years from now, but this is my story and this is my perspective. I'm Kisha Pickford. Thank you for being here.